Good day, Kaalaga! My name is Leia, your future nurse. For today, I will show you the assessment of the male reproductive and urinary system. I will just briefly discuss this area for more understanding. The male reproductive system contains the external genitals such as the penis, testes, and the scrotum, and the internal parts including the prostate gland, vas deferens, and the urethra. Its purpose is to produce, maintain, and transport sperm and protective fluid, to discharge sperm within the female reproductive tract during the sexual intercourse, to produce and secrete male sex hormones that is responsible for maintaining the male reproductive system, while the urinary system of the male functions to excrete liquid wastes from the body. It includes kidney, ureter, urinary bladder, and urethra. They filter body wastes from the blood and produce urine. The equipment needed in conducting this assessment is the examination gloves, drapes, and supplemental lighting if needed. Now, let's do the procedure. Prior to the assessment, first we need to identify the client to give the right care and management to them. Introduce yourself to the patient, explain clearly the procedure because it allows them to understand and encourages compliances throughout the assessment. Provide privacy by drawing the curtains and closing the door to allay fear and anxiety. Please do not forget to properly wash your hands for infection control and use gloves to protect the patient and at the same time protect yourself. Aside from that, ask the patient to void first to have a continuous procedure and to be not distracted while performing the assessment. Then, obtain the patient's health history. Good morning, sir. How are you?
Well, I'm good, thank you.
May I know your name and your birthday?
I'm Kevin Dale Valdez, and my birthday is March 22nd, 1998.
My name is Leia, your nurse for today. I would like to ask your permission because I'm going to do an assessment to your reproductive and urinary system. I will be the one to check your genital area to inspect if there's any abnormalities on this part. But before that, I would like to ask some couple of questions regarding to the assessment. Is that okay with you, sir?
Yes, it's fine.
What is your usual voiding patterns and is there any changes?
I go to the bathroom more than 3 times a day, and there is no changes.
Do you have a bladder control problem like urinary incontinence?
None.
Have you experienced having an abdominal pain?
Yes, sometimes when I eat a lot of foods.
Do you have a family history of having nephritis, malignancy of the prostate, or malignancy of the kidney?
None.
Have you experienced of having sexually transmitted diseases?
None.
Do you have a sexual partner and when was the last time you did a sexual intercourse with someone?
I don't have sexual partner, and I am not yet having sexual intercourse.
Okay, sir. Now let's begin with the assessment. Explain the patient on what are you going to do, then position the client supine with the feet elevated on the stirrups of the examination table. Then assist the client into a dorsal recumbent position. Sir, please do a supine position, then I will assist you into a dorsal recumbent position because it accords to the procedure and the need to expose your genital area for better examination. Is that okay with you, sir?
Yes, it's okay.
For the assessment, inspect the distribution, amount, and characteristic of the pubic hair. Then, inspect the penile shaft and glans penis for lesions, nodules, swellings, and inflammation. Also, inspect the urethral meatus for swelling, inflammation, and discharge. Okay, sir, I'm going to assess now your genital area. Okay, sir, your pubic hair is coarse and it extends up to your abdomen, which is normal. Your penile shaft is smooth and the glans penis is rounded and it's also smooth. Negative for lesions, nodules, swellings, or inflammation. Sir, can you please compress slightly your glans penis to inspect your urethral hiatus in any discharge? Okay, sir. Negative for swellings, inflammation, discharges, and any foul odor. Overall, there's no presence of abnormalities upon inspection. Remember, in a male who has undergone puberty, the pubic hair is normally coarse and sometimes it extends up to the abdomen. Having a lesion, nodule, swellings, inflammation, discharges, or any foul odor, patient might be suffering from sexually transmitted diseases or infection. Take note if the client has reported a discharge. Instruct the client to strip the penis from the base to the urethra, then take a sample for examination. Now let's move forward to the next procedure. Palpate the penis for tenderness, thickening, and nodules. Then inspect the scrotum for the appearance, general size, and symmetry. Okay, sir, I will now palpate your penis. Okay, negative for tenderness, thickness, and nodules. No palpable lumps. Now to your scrotum. It is slowly lies to your left side rather than to your right side. It implies normal. Negative for lesions, lumps, masses, swellings, or inflammation. All in all, there's no abnormalities upon inspection and palpation. Take note to inspect all skin surfaces by spreading the rugated skin surface and lift the scrotum as needed to observe the posterior surfaces. Now, proceed to the palpation of the scrotum to assess the status of the underlying testes, epididymis, and spermatic cord. Then, palpate both testes simultaneously for comparative purposes. Sir, I will now palpate your scrotum. Okay, the testes and the epididymis is intact. The spermatic cord on your left is longer than the right, and it is in the midline. There is no presence of lesions, nodules, masses, and lumps. The testes feels oval, firm, rubbery, smooth bilaterally, and freely movable. Although there's no abnormalities upon palpation. Lightly palpate the areas of the scrotum because deep palpation might cause pain to the patient. The next procedure is palpate both inguinal areas for bulges while the client is standing if possible. Then next is palpate the hernias. Okay, sir, can you please stand up for the palpation of your inguinal areas?
Okay.
Okay, sir, please hold your breath. Negative for bulges. Now, sir, repeat again the procedure. Hold your breath, then bear down to your right. Now to your left. Okay, negative for bulges, hernias on both inguinal region. All in all, there's no abnormalities upon inspection and palpation. Bear in mind that testicular cancer is the most common cancer in young men aged 15 to 35. Then, testicular tumor has no early signs of symptoms. In the inguinal areas, the patient do not need to cough because it results in abnormal findings. Additional information about this assessment is the mnemonic test TSE. The letter T means timing. The best time to assess the part is early in the morning. The letter S means shower. In the shower, for the relaxation of the muscle over the body, it is an advantage for the palpation of the scrotal findings. Now, the letter E means examine. Other than that, the mnemonic test for the prostate gland on the male patient is DRE, which means Digital Rectal Examination. It is used when the patient is at the age of 40 and above to check the enlargement of the prostate gland. Remember to document all the findings, evaluate the other needs of the client, then clean the equipment used. Discard the used gloves and drapes to a proper waste disposal. Then wash properly your hands for infection control. I hope I clearly demonstrated the assessment of the male reproductive and urinary system. Once again, kaalaga, your future nurse, Love, Leia. See you and thanks for watching. Bye!